given out of the State Disaster Relief Fund after certification by appropriate authorities. State governments have also been offered financial assistance for the purchase of essential commodities, upkeep of quarantine facilities, and treatment of infected patients. The Union government is treating COVID-19 as a notified disaster for the purpose of providing assistance under the State Disaster Response Fund. The total number of confirmed cases of novel coronavirus in the country have risen to 84, which includes the 3 patients in Kerala who recovered from the illness and went home. 7 patients admitted at Delhi's Safdarjung Hospital have also been discharged. Earlier on Friday, a 68-year-old female from West Delhi died due to comorbidity. The deceased woman had diabetes and hypertension. She has also tested positive for COVID-19. The woman came in contact with her son, who is the 5th case of coronavirus in Delhi, with a history of travel to Switzerland and Italy between the 5th of February and the 22nd of February. Marketeering of surgical and protective masks, hand sanitizers and gloves. It has invoked Disaster Management Act as well as the Essential Commodities Act to ensure price regulation and availability. State and UT governments have been directed to take necessary steps to ensure sufficient availability of surgical and protective masks, hand sanitizers and gloves at prices not exceeding the printed MRP. They've also been directed to monitor the production and distribution of these items and ensure that hoarding, black marketing and profiteering may not happen. Surgical and protective masks, hand sanitizers and gloves have been categorized as essential commodities up to the 30th of June 2020. Well, the definition of contact is that a contact is defined as a healthy person that has been in such association with an infected person or a contaminated environment as to have exposed and is therefore at a higher risk of developing disease. He's a person living in the same household as a COVID-19 case, or a person having had direct physical contact with a COVID-19 case, or a person who was in a closed environment or had face-to-face contact with a COVID-19 case at a distance of within 1 meter, including air travel. Home quarantined person should stay in a well-ventilated single room, preferably with an attached or separate toilet. Stay away from elderly people and pregnant women. Restrict his or her movement within the house. Under no circumstances attend any social or religious gathering. So those are some of the restrictions that home quarantined people need to follow. Besides that, the public health measures which are to be followed include wash hands as often as possible thoroughly with soap and water or with alcohol-based hand sanitizer. Avoid sharing household items with other people at home. Wear a surgical mask at all the times, and the mask should be changed every 6 to 8 hours and disposed of. Disposable masks are never to be reused. Besides that, used masks should be considered as potentially infected. And if symptoms appear, that is cough, fever, difficulty in breathing, he or she should immediately inform the nearest health center or call this helpline number, which is 011-239-78046. Instructions for the family members are that only an assigned family member should be tasked with taking care of such a person. Avoid shaking the soiled linen or direct contact with skin. Use disposable gloves when cleaning the surfaces or handling soiled linen. Wash hands after removing gloves. Visitors should not be allowed to visit the infected person. In case a person being quarantined becomes symptomatic, all his close contacts will be home quarantined for 14 days till reports of such case turn out to be negative on lab testing. And this is about environmental sanitation. Clean and disinfect frequently touched surfaces in the quarantined person's room daily with 1% sodium hypochlorite solution. That's how you sanitize the environment. Clean and disinfect toilet surfaces daily with regular household bleach solution or phenolic disinfectants. Clean the clothes and other linen used by the person separately using a common household detergent and dry.